Well, good morning. My name is Richard Stroker, and I work for the Center for Effective Public Policy, which is a small private nonprofit organization located in Silver Spring, Maryland, although I live in Columbia, South Carolina, and spend very little time in either place. Actually, mostly I travel around the country and work with the fine folks in this field concerning a variety of criminal justice and correctional issues. And I'm so pleased to see some of the folks in the room that I have worked with on other occasions. So nice to see some of you again. Nice to see some familiar faces, and so nice to see some new folks as well. I'm going to talk a little bit about case management today. And as I talk about case management, I'm probably going to tell you a lot of things that you already know. I will try and make it informative, I hope a little bit interesting, and at least pleasant as you spend your time in this very nice room in these comfortable chairs. So nice. It is nice, isn't it? Yeah. And you know, even this is a really, those of you staying here in the hotel, it's such a nice hotel, and even the hotel towels are nice, I've noticed. In fact, they're so plush that David, I understand, can barely get his suitcase closed. Isn't that true, David? Yeah. So I'm going to talk a little bit about case management. I'll tell you a little bit about myself. I've worked in this field for 32 years. I was at various times, the Deputy Director for Probation and Parole in South Carolina, the Chief of Staff for the Department of Corrections in South Carolina, the General Counsel for the Department of Corrections, the Chief Legal Counsel for the Parole Board, the Chief Legal Counsel for the Probation Department. I've worked in institutions and field offices. I've worked on probation and parole side and on the institutional side for 26 years. And then I retired. Lovely. And now I work full-time for this fine private nonprofit organization and do consulting work full-time. So I've been around, I've seen some things, I've had the chance to work with lots of folks, and I've been privileged to be exposed to a lot of really talented people and terrific ideas. So I'm going to share some of those things with you today. And as we talk about these things, I'm going to try and make it a little bit interactive, because I know there's nothing worse than sitting in a room and just listening to somebody rattle on indefinitely. And since I don't have any co-speakers, I'm going to involve you some as we talk about this topic of case management. And I will tell you that my exposure to adult learning has convinced me of something. People will only listen to a speaker for about 12 minutes, and I'm already 5 minutes in. So I've got about 7 minutes to tell you something interesting. And what I want to do in order to involve you a little bit in this discussion is there's some audience participation involved. In one way, Elizabeth will be wandering around. Hey, Elizabeth in the back of the room. She's going to be wandering around with a microphone. If you have a question, just raise your hand and she'll get the microphone to you, and that'll be a way for us to talk. The other way I want to do this, though, is I'm going to tell you the answers in advance. Because I also know I had the chance to teach for 10 years at the University of South Carolina, and I learned that students will only listen if they already know the answers. It helps them process their time so much more effectively. So here's a couple of answers, and I'm going to put them in the form of movie quotes, because I'm a big movie fan. And so those of you sitting on the left side of the room, when I call upon you, I'm going to call you group one, okay? You folks over there, yeah, the ones who aren't listening to me already. Okay, you folks, okay. Now, when I get to a particularly important point, I'm going to say, and what do we say, group one? And you, in unison, in your best John Wayne voice, are going to put your hands on your hips, and you're going to say, now listen up and listen good. Okay, well, let me hear it, group one. Well, what do we say, group one? Oh, that's good. That's good. I would listen to you. There's a lot of kind of key points that I'm going to try and cover. When I get to one, I'm going to call on you to help introduce it. So we'll stay focused that way. Now, group two, you're the big group in the middle here. In the movie Indiana Jones, actually it was the Raiders of the Lost Ark, the first Indiana Jones movie. There's a scene where Indiana Jones and Salah, his friend, Egyptian, really British guy, but he's pretending to be Egyptian. And they're looking for the ark, and they're they're trying to figure out where the Nazis are digging in the desert to look for it. And they realize that the Nazis are looking in the wrong place. So Salah, John Rice Davies, in his British fake Egyptian accent, puts his hands on his head, get ready, group 2, puts his hands on his head and says, "They're digging in the wrong place." Okay, that's going to be your line, group 2. So what I want you to put your hands on your head, and in your best British fake Egyptian accents, I want you to say, "They're digging in the wrong place." And to those of you of British or Egyptian origin, I apologize for whatever accent I just tried to emulate there. And then group 3, on this side of the room, and the Maltese Falcon, one of my favorite Humphrey Bogart movies. When Humphrey realizes that they've got their hands on the Maltese Falcon, he grabs his secretary, his trusty girl Friday, and he says, "We've got it, Angel, we've got it." Okay? So that's your line. I want you to put your hands in the air and say, "We've got it, Angel, we've got it." Okay. I have to work on that a little bit, group 3. Okay. You with me so far? There's a couple of things I want to tell you about case management and case planning. Number 1, most of the people that we deal with in the adult and juvenile world, in the criminal justice side of things, deal with clients, inmates, offenders, whatever title I use to describe the folks we're dealing with. I don't mean to insult anybody or to belittle anyone. I may say inmate or offender. I may be just using that for the sake of having a single word. But I'm talking about juveniles. I'm talking about clients. I'm talking about the people that you work with, attend to, serve. My first point is a simple one. Most of these folks wind up in the criminal justice system because they don't have a very good idea about where they're going. They don't have much of a plan for themselves, a point I will elaborate on. The second thing I'm going to want to talk about is that in order to really help folks move in a positive direction, we are going to have to be good at helping folks not only understand and embrace a plan, but move forward in the direction that's intended by the plan. We're going to have to be good at that work. And the third point I'm going to try and make is that our systems have to support the efforts that we're engaged in. You could work all day by yourself and only affect so many people. What we need is for systems to embrace ideas and work together and integrate the good intentions and efforts of everyone in order for us to make progress. Well, why does case management matter? Well, I think we're trying to impact public safety. We're trying to reduce the likelihood of recidivism. We're trying to have an impact on our communities, our facilities. We're trying to impact individuals so they are less likely to go about and continue to do the very things that they have previously done. We want to interrupt that cycle. And we have some ideas. There's some evidence-based research and literature that has been coming forward for the last 20, 25 years that helps us understand some very important notions about not only what we should be focused on, but how we should be talking to people and developing plans so that we might impact their behavior. And third, we need to recognize that this is a long-term proposition. What we need is a plan that follows people over time. What we can't have is a bunch of disaggregated, disconnected, individual, well-intended plans that are invented and developed by different people at different points in time that all involve a single person. What we need is to get smarter about this. We need to get better at what we do. Well, Lord knows we got plenty of business. I'm sure some of the other presenters you've heard during yesterday and today have talked about the immense number of people in the criminal justice system. When I started working in this system in the 1970s, we had less than 1 in every 90 adults under criminal justice supervision. Today it's 1 in 31. In Georgia, where I do a lot of work, it's 1 in 15. 1 in 15 adults in Georgia is currently under criminal justice supervision. We are headed in a direction, folks. And in that direction, we have criminalized many things, and we've gotten very good at catching people and punishing them. But we have to get smart about what we're doing with the individuals that we are involved with. We don't want them to continue the pattern of crime, and yet we have a tremendous number of people who are already in our systems. 5 million people are under community supervision. That's 1 in every 45 adults in the United States. And I'm not talking about previous. There's 13 million ex-felons in the United States. 3 million in 1995 were on probation. It's 4.27 million today. The numbers are just staggering. And if you look at kind of prison admission numbers, we see that there's a lot of people that are return customers, a lot of people that are recycling through our systems that are coming back. We're seeing a tremendous amount of failure. Only 41% of probationers fail to complete. Parole, the number is even less satisfactory. There's about 100,000 juveniles in this country that are in secure confinement, and about 50 to 70% of those juveniles will be rearrested within 2 years of completion of their juvenile sentence. We got a lot of people coming back through our systems, and we've got a lot of people coming out. There'll be over 700,000 adults released under community supervision this year from prison. One of the great truths, of course, when we talk about reentry work is that most people who go to prison are going to come out. There's a handful of people that are going to not come out. Life without parole, without the opportunity for parole, people who have death sentences, people who die in prison for other reasons. But the vast majority of people who come in are coming out, and they're coming back out to the communities they came in from largely. A lot of these folks are going to fail unless we change the way we do our business, unless we get focused on changing some of the things about our practices. Why do people fail? Well, you know why. How many of you deal with juveniles? Okay? How many of you deal with adults? How many of you deal with somebody else? Really? Good. Love to know what that might be. We see similar types of things reflected, although it's somewhat different for juveniles, but largely we see these issues: tremendous amount of substance abuse, lack of any meaningful employment skill, poor reasoning skills, poor criminal thinking patterns, bad attitudes, bad decision-making processes. When I got involved in this work, the first year, I worked in a prison that was so old that General Sherman actually quartered his horses there when he came through Columbia, South Carolina, and burned it in 1865. This is an old prison. And we had a warden there, a deputy warden actually. We called him Pappy Wade because he was so old. What I really find disturbing is that I'm older now than Pappy Wade was then. And I don't want anybody calling me Pappy, okay? But old Pappy, you know, you work in this business a long time, you kind of look like it. And old Pappy, he sure looked like it. And I was my first week on the job, and he pulled me aside and he said, "Richard, you know the difference between an inmate and you?" I said, "Yes, sir, they're the ones with the uniforms." He said, "No, I'm not talking about the uniforms. I'm talking about the way they are." He said, "Let me give you an example. An inmate goes up to the top of a tall building, really tall building, and he gets to the top and he jumps off. Now, when he's just 2 floors from the ground, what is he thinking?" I said, I don't know." He said, "Well, what would you be thinking?" Well, I'd be thinking, I'm sorry. I think about my kids, my family, my people I've let down. I'm asking for forgiveness." He says, "Yeah, you're going to die." I said, "Right." He said, "You think you're going to die. What's that inmate thinking?" I said, I don't know." He said, "He's thinking so far, so good." And the reason the story has stuck with me for 30-something years, I guess, is because I found it largely to be true. A lot of the folks I've dealt with that are involved in the criminal justice system don't have much of a sense of what's going to happen next, even though it's really visible to the rest of us. You know, if you keep doing this is probably going to happen to you. You keep doing that, pretty predictable what's going to happen to you. A lot of these folks just don't have much of a plan for themselves, and they don't see things coming very well, and they never have. They tend to fail at many of the things they've been involved in life: school, relationships. They're not doing too well, and they tend not to see things very clearly for the future. And as they focus on the future, they tend to have a very short view of it. So far, so good. A lot of these folks we see reflect a variety of antisocial values. They're not involved with a lot of pro-social people. Well, let me ask you, if you dropped out of high school, you're a substance abuser, you don't have a job, you probably already have some exposure to the criminal justice system, who are you hanging around with? Well, people like you, right? Everybody else is working or busy or in school or doing something. And you're hanging out with people who got time just like you do. And time is a killer in this business. Time is what leads us into so much trouble. We're not filling up folks' time very well, and they're not filling it up very well either. And as they go forward, they find more people like themselves, and so they develop a whole host of kind of less than positive associations. Variety of folks in our system have mental health problems. Up to 70% of juveniles, has been estimated, have mental health problems that are in secure custody. And often don't have a stable residence. They may have a place to go, but it's not a place that any of us would particularly want to be, and it's probably not a terribly healthy environment for them. So we got a lot of issues here to chew on. The good thing is that largely we understand what a lot of these issues are, which means that we should have some idea about what it is we want to do, what we need to attack, what we need to take on, what we need to be good at. Well, case management is important. It's important, and I use that word in a Stephen Covey kind of way. Those of you who've read like The 7 Habits of Highly Effective People, I didn't actually read it. I guess I'm not really one of the highly successful people, but I did scan it. And in scanning it, I noticed that there was this important distinction I thought he was making, and that is that our work world is divided into 2 categories, the important and the urgent. The urgent are all the things we got to do right now. Oh, so-and-so's on the phone. We got this problem with this case. There's this issue right now. I can't get over here. Got to pick this person up over there. Got to do this, got to do this, got to do this. We're so busy with the urgent, we never spend any time on what's important. And in our work, we have to take time to think about what matters. And what matters, at least for purposes of my discussion today, is that we have some kind of a plan for how we're trying to deal with the individuals that we interact with. What good is it to interact with people if they come into our offices and we ask them a bunch of static questions that mean nothing to us and nothing to them? Living at the same address, had any contact with law enforcement, paid your fines, paid your restitution, got a job, okay, see you in a month. Yeah. What good was that? Were any of the answers true? Did any of those answers matter? What did we just do? We just wasted a little bit of time. We made people come in. The only thing we know for sure, if we know that this is the individual we're supposed to be seeing, is that they're alive. That's about all we know, is that they're alive. Yeah. So what we need to do is we got to get smart about this. Case management is important, so let's treat it like an important topic, not like something we do when we're not kind of distracted by all the urgent business in front of us. This is important. It's what should be driving the way we spend our time, how we focus our system work, and how we engage our efforts and activities in order to impact the individuals we're trying to impact. Well, what is case management? I would suggest that it's the strategic use of resources, including staff time, at the case level, that's done in a particular way to increase the likelihood of success. You see, success is the point. How do we improve public safety? By having more people succeed. I want to see juveniles succeed. I want to see offenders succeed. I want to see everybody succeed. And as I get later in my presentation, you'll also notice, I want staff to succeed. I want staff to know what it's like to succeed. And the best way to help produce successful offenders, clients, inmates, and juveniles is to have successful staff people going about the work of good case management. So I'm all for success. Because when we have success, we get the outcome we really want, which is improved public safety. All right, so some fundamentals about case management. Effective case management. Oh, okay, this is a good time for group 1. What do you say, group 1?
Listen up and listen good.
Yeah, okay, that was all right. All right. Okay. Here's some important thoughts about case management. Number 1, we need to have some objectively determined considerations. I've been in this business a long time, and I've worked with all kinds of people, all kinds of judges, parole board members, case line workers, supervisors. I can't tell you how many people say, I can tell about somebody by just looking them in the eye. Yeah, there you go. Aha. Yeah, we're really not that good at that. I hate to burst your bubble. And I've been around a long time. I don't know anybody who's, I heard Ed Latessa telling this story the other day. I kind of liked it. You know, if you've ever heard of Ed, he works in Ohio, researcher guy. And Ed said that when he was coming along, every weekend he went with his father to the grocery store because it was his father's job to pick out a watermelon. And in order to pick out a watermelon, Ed's dad would thump it. You know, boom, 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 boom. He'd listen to it and he'd squeeze it, you know. And he seemed so serious about what he was doing that other people would say, hey, is this a good watermelon? You know, what do you think about this? And he'd thump their watermelon, you know. And his dad could always pick out a good watermelon. So Ed, having watched this for years, thought, well, I must be able to do that too. I watched my dad do it for years. So he'd go to the grocery store and he'd thump them and listen to them and squeeze them, whatever. And he said about 1 out of 3 would be a good one. Most of them weren't. He said because he really had no idea what he was doing. He watched his dad do it, but he didn't really know what his dad was thinking. What did his dad sense or feel or know about thumping a watermelon? So I think we're all a bunch of watermelon thumpers. We're going around thumping these watermelons like we know what we're doing, but often we really don't. And we need to get a lot better at our business than just going around and thumping watermelons. We need to get a lot better at this business than thinking that we know what we're doing. We need to actually know what we're doing. We need to get informed. And one of the ways we can get informed is by using good actuarial tools, assessment tools that give us some objective information. We may have a sense about somebody, and we may learn something about them, but in the absence of objective information, we're just guessing. We're just trying to make an informed decision based on information that may or may not be true, and our senses are often misled by things that are said. People tell us often what they want us to think. We form judgments about how people appear. These aren't good bases for really making case plans, so we need some good information. Secondly, it needs to be a comprehensive, ongoing, and dynamic case plan. A case plan is something that should follow someone over time. I mean, what if you went to a new doctor for some ailment, and they said, okay, well, I'm going to do a little workup on you here, and you said, well, what about all the stuff my last doctor did? So, well, you know, I don't know anything about that. That's not my department. Well, how much sense would that make? But in our business, we don't share information. We use different approaches. We develop different kind of plans. We're all over the place. Everybody's making up their own plan. Everybody's got their own approach. Everybody's doing their own thing. The net effect is the offender is the only one who sees how crazy we are. Because the offender's dealing with all of us. Well, they got their case plan. They don't know what they're talking about. These people over here, they don't know what they're doing. So we're all seeing this person, but we're not communicating with each other. We're not sharing information in any effective way, and we're not building towards any particular outcome. We should involve our professional partners. We're in this together. We're all in this together. All of you, obviously, as Second Act grantees, are in the process of either developing or utilizing collaborative partnerships. We're in this together. This is not like something one organization or agency can do. It takes lots of people in order to be effective at managing the issues that we're seeing with offender behavior. Next, we need to target our interventions in ways that attend to the individual needs that we're facing. Now, what I see on a lot of case plans, I was in one jurisdiction, I won't name them. I was in one jurisdiction, and I said, y'all do good case plans? This was an adult probation office. I said, y'all do good case plans? They said, absolutely. I said, I'd love to see some. They showed them to me. They showed me about 50. They were all the same. Substance abuse problem, no employment history, anger issues. Wow. I said, uh-huh. Well, where's the rest of the case plan? No, this is it. I said, well, they're all the same. I said, well, they all got those issues. In fact, we didn't even have to talk to them to find that out. We could just look at what they were convicted of. I said, great. Okay, so this is worthless, right? Because you don't really have any information here. They said, no, this is how we've been doing case planning for a long time. I said, yeah, and it stinks. Yeah. So group 2, what would we say this is the kind of case planning that we do? One size fits all. We don't really talk to the individual. We just kind of cookie cutter our way through case planning. What are we doing? Yeah, work on the accent a little bit, I think. But you know, that was reasonable. At least we got the heads on. Yeah, okay. Yeah, they're digging in the wrong place, aren't they? I mean, they're inventing a case plan that doesn't mean anything. And what are they going to spend their time doing? They're not going to spend their time interacting with the individual around this case plan. They're going to wind up interacting with the individual around their conditions. What we wind up doing often is just focusing on the conditions that have been imposed by perhaps a well-intended judge or parole board or whoever it is who cooked these conditions up, which may have nothing to do with the things that are contributing to criminal behavior, which may have nothing to do with the assessment of individualized risks or needs, which may have nothing to do with any objectively determined issues, but we're going to focus on the home confinement thing or whatever it is that the condition is. That's what we're going to spend our time doing, and we're not focusing on real case planning. We're not really working on any of the issues that drive criminal behavior. We're just watching people. And if we're just going to watch people, then what I can tell you, because we've been doing this a long time, if we just keep watching people, that 2 out of 3 of them will be rearrested within 3 years, because that's what we see. We'll catch them. They'll do something wrong. I think we can do better than that. I think we can actually interrupt the cycle of criminal behavior, and that's what we should be about. We should have a case plan that is a roadmap for success. Because when we get engaged in good case planning, we're actually helping to lead someone somewhere they may not otherwise go. We need to engage the offender in the process, and to the extent that's possible, let's take advantage of automation. Now, what is your vision for this? What do you want to see happen? What is it like in your organization? When you think about case management, case planning, what are you interested in doing? Are you interested in seeing people succeed? Could I get an amen on that? Amen. All right. Thank you. Yeah, let's see some people succeed. That's what we want to do, and let's use case management as one of the critical roads to get there. We can do it. We know that from the research, there's some things we ought to be paying attention to, and one of those things are the criminogenic factors that are likely to contribute to criminal behavior if they are not addressed. Now, here's a study from Gendreau, French, and Taylor, very famous study, 2002. David, I know you got lots of other studies than this, but it's just an example. Let's say that we focused on a handful of the really significant criminogenic, the things that drive criminal behavior. Let's say we focused on antisocial values. Let's say we focused on poor problem-solving skills. Let's say we focused on their association with antisocial folks. Let's say that we drilled down into their criminal thinking a little bit, and let's say that we attended to some of the substance abuse and employment and residence issues. Let's say that we tackled some of these. What the research tells us is that when we tackle these issues, when we identify them appropriately and tackle them, we can reduce the likelihood of recidivism by about 1/3. Staggering. This is what our work should be about. This is where we should be investing our energy. Now, let me ask you something. If you took somebody who was unlikely to fail and you do all this work, is that a good investment of your time? No, because they're unlikely to fail. So who do we want to focus on with these identification of criminogenic factors and addressing these issues through a case plan? Who should we be focused on, Group 1? Listen up and... They forgot their line already. Okay, I caught you a little bit off guard. I'm sorry. Who should we be focused on?
Listen good.
Our moderate and high-risk folks, right? What we don't want to do is just take a bunch of low-risk people that are likely to succeed anyway and invest a whole lot of time and energy in them. That's not the point. We're interested in safer communities. We're interested in successful outcomes. We don't need to spend a whole lot of time with the people who are going to be successful anyway. In fact, with low-risk people, I'll tell you this, we're more likely to contribute to their failure than to help them succeed. We create a bunch of conditions and requirements and responsibilities that they probably don't need. We're just getting in their way, aren't we? What on earth are we doing that for? You pick a bunch of people who don't need our help and we give them a whole bunch. You take somebody give me an example, some kind of category of crime. Here's the interactive part. DUI. Well, I don't want that one. Okay, all right, DUI. So you take a DUI. I was just kidding. I'm really very friendly. All right, so let's take a DUI offender. All right, let's say you got a person who's got 9 DUI convictions. Okay? You know, DUI third is what they're convicted of, but they got 9 convictions, okay? And you put them in a in a class with the person that's their first conviction. Okay. Now, what do you think is going to happen with the guy or the woman who's there with their first conviction? We're exposing them to people who are unbelievably bad in the behavior we're trying to address. We're exposing them to people who are going to give them exactly the wrong idea about what we want. Chances are we're going to make that first offender worse. And I could pick any category of crime. You take somebody who's a power rapist and you put them in a sex offender program with somebody who's a statutory rapist who had consensual sex with a 17-year-old girl, you're going to make the person convicted of the statutory rape crime worse.
Wow, I don't agree with that.
Yes, ma'am.
It starts somewhere. It starts with one.
Well, it does start somewhere. Yes, ma'am, it does. I guess what I'm suggesting is that when we take individuals and treat them like they're all the same and engage in programming that is kind of one size fits all, that what we often do is inadvertently, we wind up taking people who may really need the assistance are there, and some other people who we may be actually making a bit worse in their conceptions, in their behaviors, and in their attitudes. We may be making them worse. So we want to be smart about how we're using the resources that we have. Okay, so here's some core principles. Case management starts early. Now, I know that you're involved in reentry efforts. In my opinion, reentry starts long before people are leaving institutions. It needs to start, well, at intake or sooner. You need to start at the beginning, as soon as you can. When we start early, what we wind up doing is we start building a plan towards something. Let's take advantage of that institutional or residential time. Let's take advantage of our transition time. And then let's take advantage of our community supervision time. Let's all work together towards something, rather than working individually on pieces of something. When we work together, we're going to be more successful at accomplishing the broader and I think more significant outcome. We need to use valid tools to help guide our efforts and not just rely on our watermelon thumping abilities. And our efforts need to employ evidence-based approaches. They target the appropriate cases, which would be moderate and higher risk cases, and we need to address the issues that are driving their criminal behavior. Another important point is we need to involve the offender in this process. Now let me ask you this. If somebody was talking to you and they said, you know what your problem is? You got these 12 problems. You don't have a job, you got a substance abuse issue, you don't listen to people, you don't pay attention, you got bad attitudes, you got bad values, you got bad associates. I want you to change all that. All right, will you get busy doing that? Well, not you personally, sir. I was just pointing in your general direction. Well, thank you. Thank you for making my point. Because you know what? When people say things like that, how much impact does that really have on us? Not much. I mean, let's face it. People tell me what's wrong with me all the time. I don't pay much attention to them. Why? What's missing? What's missing when people tell you what's wrong with you?
They heard the last sentence. You're bad.
Yeah, so they may tune you out.
Yeah, and then they're like, you're genuine. Forget you.
And most importantly, I don't necessarily agree with you.
And they don't have the same expectations.
Yeah, I don't have the same. I think I'm doing fine in that regard. What are you talking about? You don't understand my situation. That's something I've been working on for years, and you have no appreciation of it. So you're telling me what I need to do. You don't have any idea who I am or what I'm doing. What's lacking is some involvement of the individual. Now, when you get me to say I have a problem, well, maybe we got some things that could happen. But until that point, you're just talking at me like I'm talking at you. When we're just talking at each other, we don't really get through very clearly. And we don't have the impact that we think we do. That's the problem with a lot of training that I see. A lot of training is set up where we put people in rooms, they sit there and listen to them, and they're dreaming about what they had for lunch and where they're going to be tomorrow and whether they're going to make their reservation or not. And we think we're getting through because they're nodding their heads just like you. I don't know if I'm getting through. I don't know what you're thinking about. What we need to do is involve people in the discussion so that they can be connected with what we're talking about. And when people get connected, then they feel that they have some ownership. In general, here's what I think I'm talking about. In our attempts to engage in effective risk reduction efforts, we want to move away from the things on the left and towards the things on the right. We want to get out of just a custody monitoring mode, keeping our eye on people, and actually engage in behavior change. That's the business we're in, folks. We want to get out of silos and have some kind of process where we work together, get out of isolation and collaborate, get out of unproven watermelon thumping methods and do things that work. We want to stop measuring inputs, like how many people came through. I want outcomes. What happened to them? I used to see reports all the time in my job at the Department of Corrections, how many people sat in a classroom. I said, well, does it make any difference? I don't know what happened to them. I don't know. I want to know what the outcome was associated with the effort that we engaged in, not just that somebody was there. And I want to get away from just capturing failure, and I want to get into promoting success. Amen. Amen. Well, if this is what we want to work towards, what does staff need? We want people to be able to assess risk. We want people to be able to motivate offenders. I do. I want to see people motivate offenders, not demotivate them, not destroy their motivation. I want to see people who can actually write a good case plan. I want to see people who know how to work with other folks. And they don't say, this is my case. This is my case. I'm working this case. As if you're the only person who has any ideas at all about what to do with this individual. And I want to see us figure out how to move forward over time and work together to develop some outcomes that mean something. Well, let's talk about those issues a little bit, because I want staff to be good at this. This is what I want them to be able to do. I want them to be able to identify the kind of information that's meaningful, and I want them to have access to it. That means if you're not using risk and needs assessment tools to find out good information about what's driving criminal behavior, that's something you probably need to investigate. Because what kind of information do you have now? What are you working with now? And when we work with folks, we're not just looking for the bad things. I will tell you that I am a big believer in a strength-based approach to managing people. I did it with my own staff. Everything I learned about managing offenders, I tried to apply to managing staff. There's nothing harder than managing staff, I'll tell you that. Man, offenders I could lock up. I don't know what to do with my staff. Well, we need to develop a strength-based approach to our work that helps motivate and encourage people to move in the direction that will help them be successful. We need to get out of our negative way of perceiving and acting and responding to folks. So how do we interact effectively with people? Well, what kind of questions are we asking them? Yes, no questions? How much do you learn from a yes, no question? Not much. Most of the time when we ask these yes, no questions, we don't know whether they're true anyway. So we don't really gain a lot of information through that interrogation method. And let me ask you this. When you're trying to change a person's behavior, which of these things do you think actually will help them change their behavior? Confronting them, lecturing them, demanding, pleading, begging, bribing, shaming? None of those work. We've tried them all. Maybe in our personal life, maybe with our friends, maybe in our families, maybe in our work. We've tried. Let me tell you one more time what's wrong with your behavior. Yeah, we don't get through to people. We have to help people appreciate the value of changing themselves. And we have to talk with people in a way that allows them to focus on that very truth. Interviewing style is important. Individuals who believe they can and will change do change. And the truth is that we change about different things. We're willing to change at different times about different things. You might take somebody with 6 problems. You may find that they are willing to change one thing now. Let's focus on that thing and let's move it in a positive direction. There will be other opportunities perhaps in the future. Maybe other individuals will be interacting with this individual to work on some of the other issues. Let's just keep going in a positive direction. We got to use our time wisely. We got to use our authority wisely. In our business, you know the old expression, if all you got is a hammer, then everything you see is a nail? Well, we've been nailing left and right, hammering left and right, finding fault left and right, catching people left and right. But in our use of authority, we could get much more comfortable at trying to move people along in a positive direction. We could help them focus on skill-building activities and problem-solving activities. We could engage in effective reinforcement. and punishment when it's due, and consistent pro-social modeling. I was in one state, I won't tell you where this one is either, but I was appalled when I went in. I couldn't tell the staff from the offenders. I saw these people walk around in their shorts and their flip-flops, and I said, well, where's the staff? They said, this is the staff. I said, oh my goodness, what kind of message are we sending here? What are we modeling for people? What are we demonstrating? What do our attitudes reflect? Are we acting like professionals? Are we behaving like professionals? That's where it starts. Because I'll tell you, I find this study from 2002 very interesting. When we're looking at factors that really influence behavior change, sure, things like extra therapeutic factors like the person's desire to change themselves, number one. But you know what was number two? Rapport with staff. It was more important than the therapeutic model that you employed. What matters is that this is people. We're in a people business. And we deal with people and work with people and interact with people. And what kind of rapport are we building with them? Because I'm telling you, we can get through to people, but we have to make the effort to establish, to create, and utilize some rapport to help people move along. So when we talk with people, what are we doing with our time? Do we explain to people what it is we're trying to do while we talk to them? Are we gathering information, really asking open-ended questions and trying to get some information from them without interrogating them? Do they have an appreciation of what the next steps are as they move forward? And as you think about the questions you ask, think about the importance of it. If you say, have you stopped taking drugs? Have you stopped taking drugs? Well, have you? Well, sure. I mean, there's a lot of ways we can phrase questions that require people to give us really unhelpful and unmeaningful answers because of the way we phrase the question. What if you said, tell me about a time when you weren't using drugs. What was different then? What a different question. You're trying to learn something. What was different then? Well, I had a job. Well, I was married then. I had a girlfriend. Or I was still, my mom was still alive. Something was different. Now you have a key. Now you have a clue. Well, let's talk about that. How important was that job? How important was that relationship in your life? Well, what are you doing about the relationships in your life? What are you doing about the job situation? Don't you think maybe there's some connection? Well, I never really thought about it, but yeah, I see it now, I got nothing to do and hanging out with bad people. Yeah, I see what you're saying. See, when I say I see what you're saying, that's meaningful. When we say things like, why haven't you gotten a job yet? Why haven't you gotten a job yet? I told you to get a job 3 months ago. Well, I've never had a job. If you ask somebody something like, did you ever do any kind of work that you enjoyed? Anything? Maybe you learned something about them. Maybe you learned something about a skill or an interest that you can help move along down the line. Instead of saying, are you still living at the same address? Why don't you say, where do you see yourself living 3 years from now? I remember one time I was over at probation, parole in South Carolina. I always had an interest in interacting with my probation and parole agent who had the most absconders. In our system, we often have all kinds of people who run off. And I'm always interested, well, why is that happening? What's up with that? So I'd get my little list, and I'd find the county, and I'd find the individual who seemed to have the most absconders on their caseload. So one day I went into this office, talked to this person. Now, I wasn't assuming that they were a bad probation parole officer, just interested. Could be a coincidence, could be any number of things driving that. So I go in and I sit down, and the first thing is, in his little office, he's got a picture of a guy in handcuffs. And it says, pay the money or go to jail. I said, we collected a lot of money, restitution, fines, fees, whatever. I said, that's kind of an interesting picture you got there. He said, yes, sir, I'm just carrying out your policy. I said, my policy? He said, yeah, I read that policy about, make sure we're paying attention to the collection of money. I said, oh my goodness, I've done this. I said, well, if people come in and see that sign, you think they're likely to empty their pocket and come up with the money, or you think they're likely to run? He said, well, they're supposed to pay. I said, well, yeah, they're supposed to. They're supposed to do a lot of things. Most of them they haven't done. So when they see your little sign, do you think a lot of them might be inclined to not come back and see you because they don't want to go to jail? He said, yeah, I see what you're saying. I said, why don't you get rid of that sign? He said, okay. I said, I'm going to sit on this guy's interview. And he had a offender coming in to talk to him. And the offender had all kinds of problems, typical case, kind of people that you would probably see, deal with. And my probation parole officer seemed to have very little sympathy for it. He was asking these kind of questions. Well, you stopped using drugs. You living at the same address. And this guy's name, the offender's name was Ralph. And I said, I couldn't take it anymore. I said, Ralph, I have a question for you. He said, who are you? I said, I work here too. He said, what? I said, Ralph, what's your dream? I mean, what are you shooting for here, Ralph? You want to be in country and western singer, or you want to drive trucks? I mean, what's your dream? What do you want to be when you grow up, Ralph? He said, well, what do you mean? I said, well, everybody's got a dream, Ralph. I bet you got some kind of a dream. If I ask you enough questions, maybe I could figure out what it is. He thought about it for a minute. He said, well, I always wanted to buy my mama a house. She lived in a trailer her whole life, raised me, took care of me. I always wanted to buy her a house. I said, that's a great dream, Ralph. That's a wonderful dream. I love that dream. How's that going for you? Oh, I don't got a job. I got nothing. I don't have any money. Said, so what you going to do about that? I guess I need to get a job. I said, yeah, that'd be a good start. So I looked at the agent. I said, you got any ideas? He said, well, there is that Michelin plant open up over there. I said, yeah, there is that Michelin plant open up over there. You know anybody over there? Well, yeah, I think I know somebody. Well, why don't you call somebody over there, see if we can't get Ralphie a job? And he kind of gave me a look. The agent gave me a look like, that ain't my job. And I gave him a look like, yes, it is. Oh, yes, it is. How about you try and get old Ralphie here a job? 3 years later, I run into Ralph in the grocery store in Irmo, South Carolina. I didn't recognize him at first, but he came up to me and he said, Mr. Stroker. Now, I've worked in this business a long time, and I know when I run into people that I don't know who call out my name, sometimes I say I am Mr. Stroker, and sometimes I don't. I'm not sure where I know you from. And I said, yeah. He said, you remember me, Ralphie? I got that job at Michelin. I'm a supervisor now. And you know, I just made the first down payment on that house. He said, if it wasn't for you, I'd have never been able to do that. I said, no, it wasn't me, Ralph. It was your dream that made it possible. So often we just don't touch people's dreams. But when we do, we help to create a fire in them that is there, even if they don't realize it. And what I want to see is I want to see us create a fire in everybody. And I want to see us move people along in a way that allows them to largely reach their very positive dreams for themselves. We just don't ask the right questions. We're often involved in kind of confronting people. And what we're not doing is looking for their strengths and identifying possibilities and moving them in a direction that will allow them to be successful. We got to involve people in this discussion because without their help, I'd never found his dream. We got to talk to people. We have to figure out how to do it well. We have to use our time and abilities wisely so that we can elicit the kind of information that will be helpful for us in creating a case plan. So here's another thought for you. All right, group one. Listen up and listen good. Good, thank you. All right, still with me. We need some targets and goals for people, don't we? We need some targets and goals that they can strive to achieve. Too often, I think we focus on too many things that are unachievable, and we only discourage and demoralize people. We need to find some realistic things that people can move towards, work towards. They have to believe that it's possible to get there from here. And what I often see is we set up targets that are too far away. We need to focus on things that are a little closer to them, a little more realistic. Rather than asking somebody if they got a job, you could ask them, have you ever been to a job interview? Well, yeah. Well, how'd that go for you? Well, I didn't get the job. Well, why not? Well, you know, I didn't know what to say about my criminal past. I said, well, let's talk about that. What do you think you'd say next time? Well, I don't know. Well, let's talk about that. Have you ever written a resume? No. Well, let's talk about that. Let's talk about what you might put on a resume. Let's write down what you might say about the crime you were involved in. You don't need to tell everybody the history of everything, but you need to figure out how to address these issues. Let's talk about that. When you come in here next month, what I want to do is I want you to bring me some thoughts about things you'd put on a resume and some things that you would talk about in a job interview and some thoughts you have about what you would say about your criminal past. That's what I want to talk about next time. And when they come in next time and they bring that to you, thank them. We're not good at thanking people. We tell them that they're supposed to do it, and if they don't do it, we tell them they're bad. They're wrong. What we have to do is get better by saying, this is what I need you to do. When you do it, thank you. When people show up in my office, I say thank you. Well, unless I don't want to see them. But we're not very good at that. We're not very good at keeping people involved, and we're not very good at setting goals for people. We say things like pay fines, get a job, get your GED, stop drinking, stop doing this, stop doing that. The conditions we come up with are largely kind of a reflection of our hopes for the future, but they're often pretty unrealistic starting point. So if we ask questions that are more focused on what could I help you do, or what can you do for yourself to develop a resume? What could I do, or what could you do to start thinking about some job interests that you have, or some skills that perhaps you could use or could learn? What we have to do too is get much smarter about this little piece, incentives and rewards. Most of the time, we've been very focused on punishing people who don't do what we say. And what we've learned is that punishment is not a very effective behavior modification tool. It's a good short run tool. You can make people do some things in the short run. But you know the kinds of people that are unlikely to be affected by punishment? What would you think? Who might be somebody who's unlikely to be affected by punishment? People who've been punished a lot. Yeah, the more we punish people, the more immune people become to punishment. That's a truth. And yet, we seem to be failing to notice that truth and acting as if the next punishment will get their attention. Well, see, people like you and me, it's easy to scare us with punishment. Man, the first time I walked in a prison or a jail, I knew that's not where I wanted to, didn't want to be an inmate. You can scare me pretty easy. I haven't been punished very much. But now somebody who's been punished their whole life, how afraid are they? They just see it as the norm. The next logical thing, probably. I'm going to get more punishment. It has less and less effect on my behavior, my perspective, and my perception. So we've got to understand the fact that behavior modification isn't largely going to be brought about through the punishment of people who've been punished a lot. It's going to be brought about through the use of incentives and rewards. And in our case plans, how are we using this idea of incentives and rewards? Most case plans that I see don't speak at all to incentives and don't talk at all about rewards. They focus more on what you have to do and the consequences, the punishment if you don't. Well, when we do things like ask folks to identify incentives for themselves, I was in one office, I believe I was in a probation office in Colorado. Anybody here from Colorado? It's interesting. The probation officer said, okay, I want you to tell me what would be an incentive for you. I want you to go to these drug rehabilitation programs. I need you to go, if you go 6 straight times, show up on time, act appropriately, I'm going to do something for you. I don't know what. You tell me. What would you like me to do? The probationer thought about it for a minute and said, I'd like to see you run around this building 3 times. You want me to run around this building 3 times? That's what you want. He said, yeah. If I go, I want you to do that for me. He said, okay. The guy went. He ran around the building. The thing is, sometimes there are things that will motivate people that would just astonish you. Just astonish you. I worked in an institution, and we had a bunch of young offenders housed there. And they were the worst. They were long-term young offenders, and they were always tearing the place up, destroying the cells, the locks, the sprinkler system, anything we put in there, TVs, anything. They destroy everything. I think it's because they could, and they had nothing else to do, and, well, they're young men. So I was talking with a bunch of the ringleaders one time, and I said, what do you want? I mean, what's the point of this? He said, what do you mean, what do we want? I said, what do you want? Why are you doing this? Why are you destroying the cells? Why are you flooding them? Why are you destroying your own commodes? I don't get it. Why are you doing this? I don't think they'd really thought about what they wanted. They were just doing it. But because I'd asked them what they wanted, they felt like they should say something. So one of them said, well, the food here stinks. I said, yeah, well, I eat the food. I don't think it's that bad. But they all picked up the chant, the food stinks, the food stinks. I said, uh-huh. Well, what do you want me to do about that? One of them thought about it, said, I think we should have pizza. Pizza. You're tearing up the cell block because you want pizza. That's what this is all about. He said, yeah, and Coke. Okay? Pizza and Coke. I said, well, I can't give you pizza and Coke for tearing up the cell block. But I'll tell you what. If you behave for a week, I mean really behave, no disrespect to the correctional officers, stop flooding your cells, stop destroying the sprinkler systems. If you really behave for a week, Friday night, I'll get you some pizza and Coke. I said, all right. All right. And something amazing happened. They started policing themselves. Hey, don't do that. We're not going to get pizza night. Cut that out. Hey, don't ask the man. We're not going to get pizza night. Friday night, I brought them pizza. Happy as they could be. And after that, I had a tool, didn't I? Y'all cut that out. I'm going to take away pizza night. I found a reward. I found an incentive. I would have never found it. I would have never guessed that's what they were going to settle for or even want. We don't ask people what they want. We assume we know. We assume we know what motivates people because we know what motivates us. Well, why doesn't this motivate you? This is what I would want. Well, because we don't know and we don't ask. And what we got to do is ask people. When we ask them, we begin to find incentives and rewards. When we find incentives and rewards, we can use them in a way to help motivate people to engage in positive change. And when they engage in positive change, then we are going to avoid doing what Group 2 likes to say. Because when we don't use incentives and rewards, what do we do in Group 2? And what would you say about this? Should we use incentives and rewards, Group 3? Oh, that was so bad it was good. All righty. So how are we going to help people, our own staffs, how are we going to help them get good at this kind of thing? Using good assessment tools, knowing how to interact with people and interview them, getting them how to write a good case plan, how to ask questions. Well, where do staff skills come from? How do people learn this? Do we hire people thinking they know all of this? How do we prepare people to be good? If this matters, if this is what it takes, what are we doing to help people get good at it? What training do we provide? What reinforcement do we provide? Here's what I find, too. In some jurisdictions that do this, they'll train their frontline staff, but they won't train their supervisors. Well, now, how much support is the supervisor going to give this activity if the supervisor doesn't even understand it? Say, well, how's that case planning coming? Great. Sure, whatever. I don't know. We've been doing case planning for 50 years. Often we just miss the opportunity to bring people along. Thinking affects behavior. What we think affects what we do. I know you know this. I know you've lived this. I know you've seen this with people you've been around. Somebody's in a bad mood. How do they act? Bad, yes, thank you. Exactly. Thinking affects behavior. And we're trying to affect behavior, so we're going to start by looking at thinking. Antisocial, distorted, unproductive, irrational thinking causes antisocial behavior. Next point, thinking can be influenced. People have influenced your thinking in your work, in your life, your friends, your family, people that you trust. They affect the way you think. They helped you create some norms, some beliefs, some ideas about how you should act, what you should do, how you should behave. Well, some folks need some help with that. And they need to find some folks who can help them think a little differently. Individuals can change how they feel and behave by changing what they think. That's our mission. We want to help people change the way they think and in turn change the way they act. Now that means we got a responsibility here. We got to think about how we're acting and how we're thinking. You know, I can't tell you how much I hate it when I'm working with folks and they call offenders or clients or inmates derogatory names. What does that tell me about how they're thinking? What does that tell me about how they're going to treat people? What does that tell me about what it's going to look like in terms of the behavior we can expect from that offender, individual, or client? Yeah. I never had trouble dealing with anybody, tell you the truth. I've dealt with death row inmates, and I've dealt with everybody. I never had trouble talking to anybody. And I think it's because I just tried to treat them like they're somebody. I'm not to be anybody special, they're a person. There's a certain amount of respect. There's a certain amount of deference that you show to people when you talk to them. You treat them like dirt, they're going to act pretty bad. You're going to affect their thinking, and they're going to treat you badly in return. If you want some of that, just act like that. You act like people can be reasonable, and you talk to them like they are reasonable people. I have found most people will, in fact, act reasonable in return. But we got to act this way ourselves. We've got to take on the responsibility to learn the skills that are important in changing behavior in others. Behavior modification involves active learning. A lot of the best programs are not just lectures like we're engaged in today. It's active learning. It's the application of skills. It's skill building. It's using the information in some practical way. There are programs that address current thinking and behavior. What are you doing now? How are you thinking now? What are you engaged in now? It targets attitudes, values, and beliefs that are tied to the criminogenic issues, and it focuses on learning. We all learn new things. We change all the time. I'm not the same person I was 30 years ago. We all change. And because change is possible, and because we have the opportunity to impact people in a way that will bring about change, we have a responsibility and an opportunity. And as we engage in this responsibility and opportunity, we have to arm ourselves with the information that will allow us to be good at what we do. Now I'm getting down towards the end. I got a lot of slides in this thing, and there's handouts that if you didn't pick up one, you can grab on the way out that contains a lot of information. I'm just kind of hitting the things I wanted to talk about. But here's something that I find is important in trying to help staff be successful. I told you I want the offender, client, individual to be successful. I want staff to be successful too. And one of the things that we often don't take into account when we're trying to do good case management is time. How are people spending their time? What are we asking them to do? I find that people are so busy and distracted doing so many things, all these good, well-intended things, but it's all detracting from their ability to actually spend quality time with people. And because we're taking time away from that all the time, we wind up with very little time to invest. And that's a shame. So one of the things I always like to ask organizations is, what could you stop doing? Organizations are good about adding work. They're good about coming up with more things. We're awful at taking work away. We're awful at stopping things. We're awful at getting rid of things. We just keep adding them. No wonder there's no time to be effective in interacting with people, because we keep layering all these responsibilities, requirements, expectations, and work activities on each other. Now imagine this. Imagine if we really got clear about what we were trying to do here, and we decided that we were going to spend the majority of our time engaged in effective case management. Let's take some things away from people. Let's give them the time to do it well. And then let's collaborate with others so that we don't have to keep starting over all the time, writing new case plans all the time, entering the same information all the time, working with the same data things all the time. Let's work together, share information, share what we've done, build on each other's work, use our time wisely. I've told people, if you've only got 7 minutes to interact with somebody, well, that's not good. But I'd still rather have you spend 7 minutes wisely than 7 minutes poorly. Even if you can't get rid of anything, how are you spending the time that you do have? What are you talking about? What are you asking people? What are you focused on in those few minutes? I think we can do better. I think we can build more time to do the things that matter. I think we can work together more effectively, and I think that we can, in fact, be more effective at behavior change. Build the time in so people can be good at this. Think about what you can get rid of in your work. I guarantee you there's stuff there. Get rid of it. I was in one office, and there was this, I was trying to find something for them to get rid of. And I tell you, you know what's amazing to me? People hang on to their work even though they don't want to do it and think it has no value. They won't get rid of it because they understand it. I found this form, and I said, what do you use this form for? I don't know. Well, who does know? I don't know. Who would know? Well, what do you fill it out for? Because I'm supposed to. Well, what do you do with it? I don't know. Well, you stick it in your case file. Does anybody look at it? No. Do you ever look at it? No. But you're going to keep filling it out. I have to. I said, well, that doesn't make any sense to me. Why don't we stop doing that? Well, no, let's not be changing the forms now. But you don't use it. Well, I don't care. I know it. And what we're afraid of is if we take away work, that people are going to get more work that they don't understand. So they hang on to everything desperately that they do understand, even if it makes no sense. We've got to stop that kind of thinking. There's only so much time to go around. Let's use our time wisely. And let's work as part of a team. Let's work together. Let's find a way to collaborate so that we can be effective at engaging in the work we're trying to do. We cannot do this all alone. We cannot do it alone. We got to be part of a broader team. And that team could be involved in the development of case plans from the beginning. Who's involved in making the first case plan? Yeah. There's all kinds of folks. But we don't work together. We're all making our own plan. We don't talk to each other. We don't share information. An institutional case plan is often made up by a single caseworker. A parole or probation case plan made up by a single caseworker. Some of you folks on the juvenile side do a little better at this. Involve some more people. Try and get some other insights and ideas, thank goodness. Let's build on that. Let's talk to each other. Each one of us doesn't know everything. We're not going to know everything. We've got to talk to each other and work with each other as part of a team in order to be effective at moving forward. And some of the people that we need to talk to are families and supports. I found in South Carolina that I would have mothers call me all the time. How could you do this to my son? How could you lock my son up? What's wrong with you people? I took so many of those calls, I got sick of them. And I finally said, you know what? I don't understand why these mothers are so mad. I want the same things that they do. And I'd ask them, I said, don't you want your son to stop committing crimes? Oh, yeah. Don't you want him to stop using drugs? Well, yeah. Don't you want him to get a job? Well, yeah. Well, why are you angry with me? There's something out of whack here. Because I think we should be on the same side. And what I found is, of course, that the offender was often telling their family one thing. It was very different than maybe what we're telling the offender. And we're not talking to the family at all. I said, let's get these families in here. Let's talk. Let's do some orientation with families. Let's talk about what these conditions are and what they mean. Let's talk about what our expectations are. Let's talk about what we're looking for. I guarantee you, we're on the same wavelength. If somebody cares about this individual and wants to see them succeed, they should be on our team. Because that's what we want. We need to convey that. We need to find out what they expect from us, how we can keep them informed, what they're looking for. I'm tired of hearing from angry mothers who are mad at me. I want some happy mothers. And then I started getting calls, you need to go pick him up, he's down at the bar again. All right, well, it wasn't exactly a happy call, but at least it was a different kind of call. It was a call by people who thought maybe we're on the same side of this issue. We're trying to work together. Families and supports have insights and information. We should use their information. We should talk to victims. We should gain their perspectives. We should be talking to lots of people in order to appreciate what it is that we're trying to do. We often are trying to do this alone, and we're not very successful at doing that. And the last thing I want to mention, then I'm going to open it up for some questions, is we got to figure out how we're doing. We're often not very good at measuring what we do or how we're doing. What we need to do is get better at understanding the things that work for us. We're trying to change staff skills. How are we doing at that? We're trying to change outcomes with the clients or probationers or juveniles we're involved with. How are we doing at that? We want to make some modifications to our policies. What happened as a result of it? I want to measure outcomes. I want to understand what happens when we make changes. I want to understand what we need to do in order to be effective at this work, and then I want to understand when we are, because that's what I want to replicate. That's what I want to do over and over again. Conditions, one of my favorite. We load people up with conditions they can't meet. We just create more failure. We load low-risk offenders up with things they don't need to be doing. We just create more failure. We need to get more focused on identifying the things that drive failure and interrupting it. What we need to do is to get better in our work. I think we have the tools to do it. I think we have the information to do it. And I appreciate your attention today. Thank you.